Welcome back to our lifelong learning series. Hello, I am Kelly Mackey, Family and Consumer Sciences Extension Agent in Callaway County. Today's episode is all about exercise is for everyone. Yes, indeed, exercise is for everyone. An estimated 67% of older adults report sitting for more than 8 hours per day, and only 28 to 34% are physically active, according to the United States Department of Health and Human Services. Exercise or movement doesn't have to be intense to be effective. There are many ways and opportunities in your daily life to add in extra movement. Let's dive in and learn about how you can make an active choice to improve your health. By the end of our session today, we will be able to understand the benefits of physical activity in our daily routine, understand the physical activity guidelines recommended by the CDC, discuss different exercise techniques appropriate for everyone, including a routine complete with strength, balance, and flexibility exercises, and also set some short-term and long-term goals to increase our physical activity. Consistent physical activity is one of the most important things that you can do to improve your overall health. Regular physical activity can lower risk of type 2 diabetes, heart disease, high blood pressure, stroke, and cancer. It also prevents weight gain and can improve arthritis symptoms. It is especially beneficial for older adults as it can reduce the risk of falling, help prevent weak bones and muscle loss, extend years of active life, and delay the onset of cognitive decline. The American College of Sports Medicine states that exercise reduces and prevents many of the declines in function associated with aging. The World Health Organization also agrees and says it pinpoints physical activity as the most effective way to influence a person's health and ability to function, which can maintain a high quality of life in old age. Adding physical activity to your everyday routine can aid in your mental well-being as well. Some immediate benefits include improved mood, increased energy, reduced stress, and improved sleep. Long-term mental benefits include improved focus and cognitive ability, improved motor control, improved self-esteem and self-worth, and a decrease in depression symptoms and behaviors. One of the great things about physical activity is that there are many ways to be active. You can be active doing the things you normally do during your day, such as housework, walking the dog, or taking the stairs. Exercise doesn't have to feel like exercise. Do something fun that is also moving your body, such as working in the garden, dancing to your favorite song, taking a brisk walk in the mall on a rainy day, or walk around while talking on your phone. Just 30 minutes a day of physical activity can help improve your health and decrease your risk of chronic disease. Adults need to get a total of a minimum of 2.5 hours or 150 minutes a week of aerobic physical activity. This should be at a moderate level, such as a fast-paced walk. For youth ages 6 to 17, the CDC recommends 60 minutes of physical activity every day. Adults need to also do 2 types of exercises or physical activity each week to improve their health: aerobic and muscle strengthening. Aerobic activity is anything that gets your heart moving faster. Muscle strengthening is any activity that makes your muscles work harder than usual. The CDC recommends adding a muscle strengthening activity at least 2 days a week in addition to your aerobic activity. If you can't block out a full 30 minutes a day, plan to sneak in movements throughout your day. It can be as short as a minute move break, or for example, you can get your heart rate and breathing up by taking a brisk walk for just 10 minutes. If you can do that 3 times a day, you've reached your 30 minutes of physical activity a day goal. Remember, you can split up your movement however you need it. All movement counts. You can also get the same health benefits in half the time if you step up your movement to a vigorous intensity level. Activities that might count as more vigorous would include things like hiking uphill, running, swimming laps, heavy yard work, or jumping rope. You can use the talk test to tell if a physical activity is at a moderate or vigorous intensity level. While doing the physical activity, if you're breathing hard, but you can still have a conversation easily, then it is a moderate intensity level activity. If you can only say a few words before you have to take a breath, then it is a vigorous intensity activity. Physical activity can fall under 3 different types of fitness: aerobic, muscular, and flexibility. There are many benefits of varying your physical activity to include all 3 types of exercise. Aerobic activity is also known as endurance exercises. This type of exercise can improve one's heart health tremendously. Walking, biking, rowing, cycling, jogging, swimming, and dancing are just some of the examples of aerobic or endurance exercises. Muscular activity is also known as resistance or strength training. When muscles work against some kind of resistance or force, they become strong. Resistance can be in the form of weight machines, hand weights, soup cans, water bottles, or stretch bands and tubes. Daily activities such as cleaning, gardening, and walking may also help in maintaining muscle strength. Flexibility is the ability of joints to move through their full range of motion. Maintaining flexibility throughout aging can make everyday movements easier and less painful. Flexibility can be increased through the activities such as stretching and yoga. If you are new to physical activity, flexibility may be the best place to start. The good news is that exercise doesn't have to be scary or something that we dread. All of the physical activity that we do throughout the day adds up, and most important, it can be fun. Ideas we haven't mentioned yet are take an exercise class or just do exercises at home. Your local senior citizen center is an excellent place to look for classes. Join a sports club for older adults, like a bowling club or a bocce league. Walk or bicycle with a friend or neighbor. Take a swimming or a water aerobics class. Play with your grandchildren. Teach them a game or a dance that you remember from childhood. You don't have to be a world-class athlete. You just have to move your body with purpose. Before you begin any type of exercise program, here are a few things to keep in mind. Safety always comes first. If you haven't had regular checkups, you might want to talk with your doctor before beginning your workout plans. Ask if there is anything that you need to know about your condition that you can need to modify your exercises to do them safely. Always listen to your body and do what you can do as long as you're comfortable. It's really important to start slow. You can always increase the length or the intensity of your exercises as you improve. Unless your doctor has asked you to limit fluids, be sure to drink water when you exercise. Many older adults don't feel thirsty even when their body needs fluids. Be sure to wear comfortable clothes that let you move freely and shoes that are comfortable and supportive. Almost anyone at any age can do some type of physical activity. You can still exercise even if you have a health condition like heart disease, arthritis, chronic pain, high blood pressure, diabetes, or if you're in some way physically impaired, maybe in a wheelchair, you still can get physical activity into your day. In fact, physical activity may help. For most older adults, physical activities like brisk walking, riding a bike, swimming, weightlifting, and gardening are relatively safe, especially if you build up slowly. You may want to talk to your doctor about your health condition and how it might affect your ability to be active. So ask your doctor, are there any exercises that you should avoid? Make sure your preventative care is up to date. And does your health condition affect your ability to exercise? During this part of our program, we are actually going to look at a series of strength, balance, and flexibility exercises that will give you a great workout. And it's a perfect workout for beginners. For the workout, you will need 2 tennis balls, a sturdy chair with arms, a towel, and 2 equally weighted objects. These can be hand weights or wrist weights. They can be soup cans or water bottles. You may need to start with a 1 or 2 pound weight, and as the exercises become easier, you can gradually add more weight. So let's get started. We are using a sample workout from the National Institute on Aging, which is part of the U.S. Department of Health and Human Services. We will start with a warm-up and then move on to strength and balancing exercises. We want you to try to do 3 sets of 10 to 15 repetitions for each exercise. Make sure to pause and take your time as you need to. And then we will end with a cool down using some flexibility exercises. Hopefully you have everything you need to work out today. Let's review a few last safety tips. Breathe regularly during the strength exercises. For example, breathe out as you lift the weight and breathe in as you relax. When doing leg lifts, breathe out as you lift your leg and breathe in as you lower it. Use smooth, steady movements when lifting the weights. To prevent injury, you don't want to jerk or thrust the weights into position. Keep your arm and leg joints slightly bent. Avoid locking your arm and leg joints in a tightly straightened position. Make sure to choose a sturdy chair with arms, and make sure it's stable enough to support you when seated or when holding on during the exercise. Make sure to make slow, steady movements and never bounce into a stretch. Always bend forward from the hips, not the waist. If you keep your back straight when you're bending, you're doing it the right way. And remember, stop if you feel pain. Now, you might feel some soreness after you exercise, and that's okay. But exercise should not hurt or make you feel really tired. In fact, in many ways, being active will probably make you feel much better. It's important to spend about 5 minutes at the beginning of your routine to warm up. Warming up gives your muscles a chance to get ready to work. Warm-up activities can help you prevent injury, and they will reduce muscle soreness later. Some suggestions for your warm-up might include taking a walk, even if it's just around your house, riding a bike, dancing around your living room, or walking up and down the stairs a few times. Let's start the strength exercises with the hand grip. Hold a tennis ball in each hand. Slowly squeeze the ball as hard as you can and hold it for 3 to 5 seconds, and then relax slowly. And you'll want to repeat this series of motions 10 to 15 times. Once you've done this 10 to 15 times, that will count as 1 set. Rest for a moment, and then repeat the steps 2 more times. This will give you a total of 3 sets of 10 to 15 repetitions. This is going to be the same process for each of the strength and balancing exercises. Let's move on to the wall push-up. Face a wall, standing just a little farther than arm's length away and about your feet shoulder width apart. You will want to lean forward and put your palms flat against the wall at shoulder height and shoulder width apart. Slowly bend your elbows and lower your upper body toward the wall, making sure to keep your feet flat on the floor. Hold the position for about 1 second and simply slowly push yourself back until your arms are straight. And again, repeat 10 to 15 times. This is a wonderful way to do push-ups. Overhead arm raise. You can do this exercise while standing or sitting with your feet flat on the floor. You'll want to hold your weights or your soup cans or your water bottles at shoulder height with your palms facing forward. You will slowly raise both arms up over your head, keeping your elbows slightly bent. Hold for about 1 second and then slowly lower your arms. As you progress, you can begin to use heavier weights. When you do this, you'll want to alternate your arms and only lift one arm at a time until you can comfortably lift the extra weight with both arms at the same time. The back leg raise. For this exercise, you'll want to stand behind a sturdy chair holding onto it for balance. You'll slowly lift one leg straight back without bending your knee or pointing your toes. Try not to lean forward. It will be best to stand as straight as you possibly can. The leg you're standing on will be slightly bent. Remember, we do not want to tightly lock our knees or any of our joints. You'll hold your leg in this position for 1 second and then slowly lower your leg. Repeat 10 to 15 times and then alternate and do this 10 to 15 times on your other leg. This exercise can be one that you can add ankle weights to later as you progress. You can also challenge yourself to improve your balance during this type of exercise, and we'll discuss more about that when we get to the balance exercises. The side leg raise. Same process, except this time you're going to slowly lift one leg out to the side. You'll keep your back straight and your toes will be facing forward. The leg you're standing on again will be slightly bent. Hold the position of your leg in the air for about 1 second and then slowly lower your leg. Repeat 10 to 15 times and then do the same process on the other side. As you progress, you may again want to add ankle weights, and this exercise also is one that you can work on your balance. The toe stand. Again, you're still standing behind a sturdy chair, feet shoulder width apart, holding on for balance. Slowly stand on your tiptoes as high as you possibly can, hold for about 1 second, and then slowly bring your heels back down to the floor. And repeat 10 to 15 times. As you progress, try doing this exercise while standing on just one leg at a time. And just alternate legs. This is a great way to exercise and challenge your balance as well. So now we're going to move on to some balancing exercises. We'll start with a stand on one foot. Stand on one foot behind a sturdy chair, which you can hold onto for balance. And just hold that position for about 10 seconds. And then slowly lower your leg. And then lift it up again. Hold for 10 seconds and back down. Repeat this process 10 to 15 times. Then switch to the other leg. Heel toe walk. Now, if you are unsteady on your feet, make sure to do this exercise near a wall so that you can steady yourself if you need to. Place the heel of one foot just in front of the toes of the other foot so that they touch or almost touch. And then raise your arms to your sides at shoulder height. Choose a spot ahead of you to focus on that will help keep you steady as you walk. And then just simply take a step by putting your heel just in front of your other foot. Heel, toe, heel, toe. Step that way for about 20 steps. Rest for a moment and then repeat 2 more sets. The balance walk is slightly different. You're going to raise your arms to your sides, shoulder height. Again, choose a spot in front of you to help keep you focused and safe while you're walking. Walk in a straight line with one foot in front of the other. But as you walk, you're going to lift your back leg slightly and hold it for just a second before you put that foot down to take a step forward. With the other leg, lifting your knee slightly, hold, and then step forward. And repeat this for 20 times. Exercises to strengthen your legs and ankles also can help improve your balance. As you progress, try adding these challenges to help you even more. You can start, obviously, by holding on to the chair with both hands for support. When you feel steady, challenge yourself by maybe only holding them with one hand. As you feel steady, you can use just one finger for balance. And when you're ready, try doing the exercises without holding on at all. When you're really feeling good about your balance, try doing the exercises with your eyes closed. Balance exercises are a great way to help prevent falls. Cooling down at the end of your workout gives your muscles a chance to gradually return to rest. Again, this is important to prevent injury. To cool down, take about 5 minutes to do these four different flexibility exercises. We'll start with our ankles. Sit securely toward the edge of your sturdy chair, and with your hands on the chair and your heels on the floor, you're going to bend your ankles to you and point your toes up toward your body. Hold for about 10 to 30 seconds and you'll feel a really nice stretch. Then bend your ankles and point your toes as far away from you as possible and hold for 10 to 30 seconds. Repeat this about 3 to 5 times. Let's move on to stretching our backs. Now, if you've had hip or back surgery, you will want to talk to your doctor before trying this stretch. You'll sit toward the front of your chair with armrest and with your feet flat on the floor. Stay as straight as possible and slowly twist to the left from your waist without moving your hips. Turn your head to the left and put your left hand on the arm of the chair. Take your right arm and place it on the outside of your left thigh. And then hold this position for about 10 to 30 seconds. And then slowly return to face forward. And repeat this 3 to 5 times. Reverse that position and do the exercise to the right side. You will feel a really nice stretch in your back. As you progress, try lifting your left arm and resting it on the back of your chair and then taking your right arm and putting it on the arm of the chair. You will be able to pull and get a stronger twist and a nicer stretch. Now let's move on to our thighs. Again, if you've had hip or back surgery, make sure to talk to your doctor before doing this exercise. Standing behind your chair with your feet on the floor, shoulder width apart, and your knees straight, you will hold onto the chair for balance with your right hand and bend your left leg back and grab your foot with your left hand. Keep your knee pointed to the floor. If you can't grab your ankle, take a resistance band or a belt or a towel and loop it around your ankle and then hold both ends of that towel or belt. That way you will gently be able to pull your leg until you feel just a nice stretch in your thigh. Hold the position for 10 to 30 seconds to get that nice stretch and then slowly lower your leg. And then repeat that step 3 to 5 times on both legs. And lastly, we're going to stretch out our shoulders and our upper arms. If you have shoulder problems, talk to your doctor before trying this stretch. With your feet shoulder width apart, you're going to hold one end of a towel in your right hand. Drape the towel down your back. And then reach behind your lower back with your left hand and grab the other end of the towel. Pull the towel down with your left hand, stopping when you feel that stretch in your right shoulder. Hold it for about 10 to 30 seconds and then release. Repeat 3 to 5 times. And of course, you'll want to stretch the other arm as well. As you progress, try pulling the towel down a little further, not so far that it hurts, but just a little bit further. You'll get a nicer stretch. And remember to breathe. Inhale a large breath And then as you pull down on the towel, exhale nice and slow. So no matter how big or small your goal, whether it's losing 5 or 50 pounds, walking a mile, running your first 5K, or simply just making a commitment to add more physical activity into your day, it requires planning and goal setting. What exactly are you going to do to increase your physical activity? This makes your goal specific. How will you track your progress, and how will you know when you've reached your goal? This makes your goal measurable. You have to know your limits. So is the goal within your capabilities? That ensures that whether it's a short-term or a long-term goal, that it is achievable. Set goals that are important to where you are in your life right now. Don't set a goal that someone else is pressuring you to attain that isn't very motivating. Make sure your goal is relevant to you. And make sure to set an endpoint. That makes your goal timely. Short-term goals can be very simple, such as today I will just decide to be more active. Tomorrow I will find out about exercise classes in my area, or in the next 2 weeks I will make sure I have comfortable clothes and shoes that I need to start walking. Long-term goals will be more complex, but don't get overwhelmed with long-term goals. Just simply break them down into more manageable pieces. By this time next year, I will swim a mile 3 times a week. Next summer, I'll be able to play pitch and catch with my grandchildren. Or in 6 months, I'll have my blood pressure under control by increasing my physical activity. Just break those down into small steps, and 30 minutes a day of physical exercise will help you meet those goals. Remember, physical activity and exercising is simply purposely moving your body. Physical activity is an important part of healthy aging. The National Institute on Aging can be found at www.nia.nih.gov. It's an excellent resource for tips on how to fit exercise into your daily life safely and get motivating to get moving. You'll find many wonderful articles, including articles on how to stay motivated to exercise, how to find the right fitness clothes, exercising with chronic conditions, different workouts, and more. You can also download the FitBlue app on any smart device. The FitBlue app is designed for walking challenges, and it's a free app from the University of Kentucky Family and Consumer Sciences. Even if you are not using the app for a particular walking challenge, you will enjoy the other benefits that you can find inside the app. In addition to exercises that are complete with modifications, you will also find healthy recipes and mindful activities, which, when we combine all 3 of these activities, definitely will improve our overall health. Thank you so much for joining us today in our lifelong learning series. I hope that you are motivated to just simply move your body with more purpose every day. If you need any more information, make sure to contact your local extension office, and they can make sure and provide you with many resources that will help you get lots of physical activity into your day. Thank you.